My name is Ashley and I've been an ultrasound tech for about five and a half years now. I started back in 2019. I graduated in February. I got my first job in May. I was pretty lucky getting it that quickly. So I actually wouldn't have had a thought about being an ultrasound tech except for the fact that when my son was 4 months postpartum, I started having a really intense pelvic pain. I compared this pain to when I was in active labor. It was severe. I was doubled over. I was crying. So I went to the hospital, of course, and I got basically the worst treatment I could have expected. The nurse told me I needed to relax and calm down because she had people who were having real emergencies. They did a quick over-the-tummy ultrasound and said, "Oh, you just have an ovarian cyst," and gave me a bottle of Norcos and sent me home. The pain continued. I'm there trying to take care of a 4-month-old baby. I was staying home with him, and I couldn't handle it anymore. So about a week went by. I was out of the pain medication. I went to a different hospital, and they did an ultrasound immediately, and they said, "Oh no, you're going to surgery today." It turned out that little cyst that they had found was actually a 12-centimeter dermoid mass, and it had twisted and killed my ovary. So that whole week, instead of them immediately fixing the problem, finding out why I was in such acute pain, they just wrote me off with some pain medication, and in that time my ovary had died. So I lost my ovary, I lost my fallopian tube, and then while I was in for that immediate surgery, they actually nicked my bowels. So what started as a laparoscopic, you're gonna leave here the same day surgery, ended up in a 5-day hospital stay eating nothing but broth and Greek yogurt. So with the terrible bedside manner and everything that I received beforehand, and the fact that they said it's just a cyst, and then I come to find out there was a 12-centimeter whole mass, that got me really interested in what went wrong the first time. How did it get missed? What did they actually do? What can they actually see with ultrasound? So after my son turned 1 and I wanted to go back to school for something, I wanted to dig into something, I chose ultrasound. What I do now is I got to the point where I teach other techs. I am the lead tech of the desert now, so my job is making sure everyone else is doing the best that they can possibly do, making sure that we're not missing things like that for our patients. The whole patient care aspect of it is what I love. I love to make sure that everyone's getting the best care they can, that we're finding the problem, that we're helping the patient. I like to treat them as if they were my own family member, or as if it was myself, how I would want to be treated. It's not a conveyor belt. We may see a lot of patients in and out. If our exam time is going to take longer than it takes to see what we need to see to get the most diagnostic exam possible, that's what it's going to take. In school, everybody wants to get the RadNet sites. The RadNet sites are prestigious. Everybody wants it because they do everything. You get the most rounded education. My life has changed because I love what I do now. I come in happy to see my patients. I have patients who are kind of regulars. They come back for follow-ups. I have a little rhino that one patient crocheted for me. I keep it on my desk for when I'm doing my paperwork. I love talking with my patients, chit-chatting with them, seeing what's going on with them. And then, of course, my job is interesting. I get to look at people's insides all day, see things that are wrong. Some different pathologies look cool to us. Seeing it from our standpoint, it's an educational thing, and it's something we're finding that's going to help the patient in the long run. So it's a rewarding job knowing that we're helping people, and I get to talk to people and be nice people. My absolute favorite person is Ashley Rep. She's our director of ultrasound, and she's inspired me to be the friendly, positive influence on our techs. I love my coworkers. Everyone always is doing the best that they can do. We try to always work as a team to get things done. If someone's room has an opening and someone else is behind, we take that patient off their hands. I'm particularly proud when I hear positive feedback from our radiologists about techs that are doing better, techs that I've helped train, and they give me positive feedback about their exams. That makes me proud, is knowing that people are doing better because I'm here. I love what I do, and I love my time to be out and to be me and to do something that I love, because ultrasound is completely tech dependent. If we don't see it, the radiologist doesn't see it. The impact that I'm making, I feel, is huge.